Definition of a stupid is that knowing the truth, seeing the truth, but still believe the lies. So this is a true definition of a stupid, that is by true man who is well known person. Now, coming to the classification of hypothyroidism. Hypothyroidism is mainly of two types. The one is primary and the other is secondary, or sometimes called central. So primary is that which is seen itself some defect in the thyroid gland itself, and it has four types. That is the primary one. So I am discussing the primary first. It is number one because of the enlarged thyroid, and in those cases Hashimoto is contributing about 65%, then iodine deficiency of 25% cases, then drug induced by the lithium, which is psychotropic drug, that is also causing that. Then this hormogenesis, the hormone production is not normal. Second variety of the primary is the normal thyroid. The thyroid is normal, but there is spontaneous atrophic changes occur in the thyroid, so that it goes into the hypothyroidism. The third variety of the primary is post-ablative. Ablative means when thyroid has been removed. So the changes which are hypothyroidism, they are sometimes permanent, sometimes transient, and sometimes these are subclinical. The fourth variety of the primary is congenital, as the name is, that the thyroid is congenitally absent or congenitally malfunctioning, so that is going to cause the primary hypothyroidism. Now, coming to the other variety, that is secondary or the central. In this case, there is some defect in the pituitary or hypothalamic dysfunction that is leading to the hypothyroidism. Now, primary hypothyroidism, it is because the previous radioiodine treatment have been given to destroy the thyroid gland, previous external beam radiotherapy to the neck for any kind of cancer in the neck, for that radiation is needed and given. Medication besides lithium-based mood stabilizer, amiodarone, that is antiarrhythmic drug, that is also culprit for hypothyroidism. Then interferon alpha tyrosine kinase inhibitors such as sunitinib, that is also blamed for this problem. Now, congenital hypothyroidism, that is thyroid dysgenesis, thyroid is not produced properly, that is in 75% cases. Then thyroid dysharmogenesis, the thyroid is there, but the hormone is not properly produced, that is in 20% cases. Then maternal antibody or radioiodine transfer that goes through the maternal blood to affect the infant and causing the congenital hypothyroidism. Sometimes the syndromes, that is Pendred syndrome, that is associated with sensorineural hearing loss, is also responsible. Transiently, temporarily, due to the maternal iodine deficiency or the excess of iodine, or there is anti-TSH receptor antibodies are also responsible. Certain congenital disorders and neonatal illnesses are also responsible. Central is pituitary dysfunction, isolated TSH deficiency, so that is also the reason of congenital hypothyroidism. Now, central, or that is also called secondary hypothyroidism. Central mean it is secondary plus tertiary. Now, lesions comprising pituitary gland, pituitary adenoma, craniopharyngioma, meningioma or glioma of the pituitary gland, and these are causing the hypothyroidism. Then there are certain cysts, metastases, aneurysm of the internal carotid artery are also blamed. Surgery or the radiation to the pituitary gland, certain drugs and injury to the gland is also one of the cause. Sheehan syndrome, suprarenal hemorrhage, then autoimmune diseases like lymphocytic hypophysitis, polyglandular disorder. These are all the diseases of pituitary gland and causing the hypothyroidism. Infiltrative diseases like iron overload due to the hemochromatosis or the thalassemia, neurosarcoidosis, Langerhans cell histiocytosis, and then the infections like tuberculosis, mycosis, and the syphilis are also blamed for central or secondary hypothyroidism. There is a term which is used, consumptive hypothyroidism. It is the high level of type 3 dehydrogenase inactivate thyroid hormones leading to the hypothyroidism. So because of that type 3 enzyme dehydrogenase that inactivate the thyroid hormone causing the hypothyroidism. It rarely occurs in case of the hemangioma. Now, the causes of the hypothyroidism. First is inadequate function of the thyroid gland itself. So that is called primary hypothyroidism. I have told you already. Then inadequate stimulation by the thyroid stimulating hormone TSH from the pituitary gland, and that is causing the secondary or the central hypothyroidism. Then inadequate release of thyrotrophin releasing hormone from the brain's hypothalamus, that is called tertiary hypothyroidism. As you know that the hypothalamus stimulates the pituitary, and pituitary ultimately stimulates the thyroid gland, that is the axis pituitary and hypothalamus, pituitary and thyroid gland. Now, primary thyroidism is more common than the secondary or the central hypothyroidism. Mean the defect I have already told you, that is mainly the thyroid gland itself. Iodine deficiency is the main cause of primary hypothyroidism, and endemic gutter worldwide is seen because of this deficiency. In areas with no iodine deficiency, the cause is autoimmune disease or Hashimoto's thyroiditis, that is chronic autoimmune thyroiditis. Causes continued. There is infiltration of thyroid gland with T lymphocytes. It may be associated with a gutter, autoantibodies against thyroid antigens, thyroid peroxidase, thyroglobulin, and TSH receptors is also. Treatment with radioactive iodine, antithyroid medications, and lithium is also one of cause. Injury to the hypothalamus or anterior pituitary gland, then thyroid gland removal surgery. There is lack of functioning thyroid at birth, that is the congenital hypothyroidism, or after delivery, 5% of people develop postpartum thyroiditis. High estradiol level causes increased production of the thyroid binding globulin, that is TBG, via the liver, and here there is an inhibitor protein that binds and reduces T3 and T3 availability in the blood causing the hypothyroidism. Continuing the causes, too much or too little iodine in the diet, then heart medicine or the cancer medicines are also notorious. Thyroiditis or the inflammation of the thyroid gland causes stored thyroid hormone leakage, first causing the thyrotoxicosis, then the thyroid gland becomes underactive or exhausted permanently, causing the hypothyroidism. Three types of the thyroiditis causes thyrotoxicosis, that is followed by the hypothyroidism. Number one is subacute thyroiditis, a painfully inflamed and enlarged thyroid gland. Number two is postpartum thyroiditis, as the name is, it develops after the delivery, so the name is postpartum thyroiditis. Third is silent thyroiditis. It is painless. Thyroid may be enlarged, probably an autoimmune condition. Now, there one can see the causes of hypothyroidism. Number one, iodine deficiency in diet, then inflammatory process of the tissue of the thyroid gland, that is Hashimoto's, complete or partial removal of the thyroid gland, the unfavorable environmental factors, that is radioactive radiation, work in harmful production of the thyroid, then anomalies in the intrauterine development of the organs of the endocrine system, and one of the system is also the thyroid gland, that is the congenital problem. The use of radioactive iodine for the therapeutic purpose, that is for curing the thyrotoxicosis, then drug therapy depressing the thyroid function, and the damage and the inflammation of the hypothalamus, ultimately that is just having the effect on the thyroid gland indirectly, that the hypothalamus not releasing TRH and the TRH not affecting on the pituitary to regulate the thyroid via the TSH. Now, the pathophysiology of this disease is in blood, thyroid hormone is 99.97 is bound to the plasma protein, that is called thyroxine binding globulin. Only free thyroid hormone is biologically active. Thyroid gland is the only source of the thyroid hormone in the body, and the process requires iodine and amino acid tyrosinase. Iodine in the blood is taken up by the thyroid gland. It joins with the thyroglobulin molecules. That is controlled by the thyroid stimulating hormone TSH, and ultimately by the hypothalamus TRH hormone. If not enough iodine or not enough TSH, not enough TRH, which is very rare, there is decreased production of thyroid hormones. So here one can see the hypothalamus releasing the TRH and affecting on the pituitary gland. Pituitary gland that releases the TSH, which affect the thyroid hormone, thyroid gland to produce thyroid hormone, that is T3 and T4. If there is excess production, there is negative feedback inhibition to the pituitary gland as well as to the hypothalamus to just control the release of TRH and TSH. Now, production of the TSH and the TSH is decreased by thyroxine by a negative feedback process. I have already shown you in the diagram. Pregnancy leads to the marked changes in the thyroid hormone physiology. Gland increases in size by 10% normally physiologically, and thyroxine production is increased by 50%, and iodine need is increased to just supply to the mother as well as to the fetus. Many women with normal thyroid function have thyroid autoimmunity, positive autoantibodies, or they are iodine deficient and develop hypothyroidism before or after giving birth. Now, what are the complications of hypothyroidism? During pregnancy, cretinism or short-sized fetus and the birth defects in the baby are seen. In adults, obesity is there. Infertility in the female due to the altered ovulation in the female. Goiter, if large enough, that can interfere with swallowing and breathing as it is lying over the trachea, so it presses the trachea and also presses the esophagus which is lying there. Peripheral neuropathy and the joint pain is there. Heart disease, there is increase in LDL cholesterol, which is called the very bad cholesterol and responsible for the heart attacks. Depression and low mental health and myxedema coma is there. I have already told you before. Now, here one can see the complication of hypothyroidism, congenital hypothyroidism. I have already told you that is cretinism, the short-sized baby, and hypothalamus has several potential complications if it is not treated well in time. That is causing the heart problem, mental health, depression, I have told you, peripheral neuropathy, goiter, large-sized thyroid gland, infertility, and myxedema. Here is a beautiful painting painted by a person. One can't believe that here is a person who is just making the eyes, and here is the picture has taken the advantage of the different things, the trees, the weather and everything to make some awesome painting. It's unbelievable. Now, coming to the diagnosis, the disease, there are 4 points in the diagnosis. Number 1 is history and physical examination. Number 2, the blood test. Number 3, imaging. And number 4 are biopsy. First is the history and physical examination. There is history of living in iodine deficient area. Signs and symptoms of classical hypothyroidism like obesity, intolerance to cold, hair loss, etc. is seen. Examination for the goiter by the palpation or by the ultrasonography is also helpful. The second is the blood test. It is confirmed hypothyroidism with blood thyroid function test that include thyroid stimulating hormone TSH and thyroxine levels, free and bound T3 and T4. A second TSH level is done later for confirmation. An elevated TSH level means pituitary produces more TSH to stimulate thyroid gland. As you know, pituitary is the main source of TSH. Levels may be abnormal in other illnesses also. Certain factors can affect thyroid blood test like heparin, biotin, and vitamin. Free T4 levels are also helpful, but free T3 level is discouraged and it is not very helpful. Mild elevation in creatine kinase and the liver enzymes is there. Increased level of the cholesterol, especially the low density lipoprotein and lipoprotein A are increased. Then in myxedema coma, low sodium level plus raised anti-diuretic hormone is there. Presence of the antibody against thyroid peroxidase TPO supports the autoimmune thyroiditis. The third parameter is thyroid imaging. If thyroid feels abnormal, do diagnostic imaging like thyroid scan and iodine 131 uptake test to confirm the diagnosis. If no lump or the mass is felt, there is no need of imaging. It is done if the mass is there. Now, non-invasive thyroid ultrasonography is available to check the small enlargement of the thyroid gland. Number 4 and the last is biopsy. In doubtful case, a needle biopsy by fine needle aspiration is done. Here one can palpate the thyroid by hands from behind, then thyroid function test like TSH, T3, T4 level, then ultrasonography to see the thyroid gland, and finally the biopsy by the fine needle to take the sample from the thyroid gland and to check it under the microscope, the status of the thyroid gland functioning. Now, special diagnosis in central hypothyroidism. Here, TSH level is normal or low, and the serum free T4 level are also low. There is not enough TSH or TRH secretion by the pituitary gland or the hypothalamus respectively. Other features of the hypopituitarism, because pituitary is not functioning well, so problems like menstrual cycle abnormalities and adrenal insufficiency is also seen. Symptoms of the pituitary mass such as headache and the VN changes are also noted. Overt hypothyroidism in TSH levels are high and T4 and T3 levels are low. So that is overt or obvious hypothyroidism. TSH level on the multiple occasion is greater than 5 micro international unit per liter, and usually it is more than 10 micro international unit per liter. So that is giving the clue of overt hypothyroidism. So here one can see the thyroid function test and one can interpret that if the TSH is normal and T4 is normal, it means normal thyroid function. If the TSH is elevated but T4 is low, it means overt or clinical hypothyroidism, visible hypothyroidism is there. If the TSH is normal or low but the T4 is low, so there is central hypothyroidism, means defect in the pituitary is doubtful. Elevated TSH and the normal T4 mean subclinical hypothyroidism. Now, the special diagnosis for subclinical hypothyroidism is elevated serum TSH level greater than 5 milli international unit per liter and less than 10 milli micro international unit per liter. But normal serum free thyroxine level is there, and mostly it is caused by the Hashimoto's thyroiditis. Some have detectable antibodies against the thyroid peroxidase, that is TPO, and in cases of pregnancy, the diagnosis is that the thyroid gland must produce 50% more thyroid hormone for mother and fetus, and free thyroxine level is lower as due to increased binding to the thyroid binding globulin and decreased binding to the albumin. Check the total thyroxine levels. Antibodies against TPO is very important. TSH levels are lower than the normal in pregnancy. Now, the differential diagnosis of this hypothyroidism, these are depression, dementia, heart failure, chronic fatigue syndrome, anemia, adrenal insufficiency, and vitamin D deficiency sometimes give this kind of symptom. The people who do not believe in hard work, they just want to have the thought of having the water without having the connection with any water source, and that should come like this automatically. but this is imagination. Now, coming to the management, the first point is hormone replacement. For patient with hypothyroidism, symptoms and the thyroxine deficiency, synthetic long-acting form of the thyroxine, simple or levothyroxine, which is called L-thyroxine. Previously it was dextrothyroxine, but nowadays there is levothyroxine available, that is the better thyroxine functionally. It is available as pill, liquid or soft gel capsule. In overt hypothyroidism, visible clear hypothyroidism, full replacement dose adjusted by the weight is started immediately. In elderly, heart patient or subclinical hypothyroidism, always start with a low dose. In central hypothyroidism, give a higher dose, and free thyroxine and TSH level in blood are monitored 4 to 8 weeks later so that one can adjust the medicine accordingly. Once adequate dose is established, check after 6 and 12 months and then just maintain the dose. So here that is thyroxine 50 microgram, and that was the dextro, and here is the levothyroxine, which is available as 25, 50, 75, 100, 125 and 150 microgram. Now, continuing the management, treatment lowers the cholesterol levels and reverses the weight gain. Treatment is lifelong because you have to supplement the thyroxine for maintenance of the thyroxine level in the body and blood. Excess dose can cause increased appetite, insomnia, palpitation and shakiness. Do not stop taking if one is feeling better. Take medicine best on an empty stomach at same time every day, ideally in the morning, an hour before eating or having breakfast, or if at bedtime, take 4 hours after the last meal so that your stomach should be empty. If one misses a dose, take the two pills next day. Certain medications like iron supplements, aluminum hydroxide, calcium, cough syrups, and some food like soya products or the high fiber diet, these do affect the absorption of the levothyroxine. So please do consider to not take excess of these so that you can avoid the non-absorption of the thyroxine. Now, symptoms of the thyroid hormone replacement, over medication if the excess is taken, that is anxiety, nervousness and tremors, difficulty in concentration, feeling overheated, then feeling irritable and erratic, difficulty in sleeping, and heart rate is increased. Now, management, other options are liothyronine. People not well with optimal levothyroxine dose need adjunctive or supportive treatment with liothyronine. It is a synthetic T3. It is added to the levothyroxine, but combined T3 and T4 therapy carries a higher side effect than T4 alone. So just have synthetic T3 and add with, that is the liothyronine with levothyroxine. Liothyronine has shorter half-life, so that have to be taken many times in a day. In the past, there was available desiccated thyroid extract, that is an animal-based thyroid gland extract from the pigs was taken. It contains T4, T3, but plus in addition, calcitonin, that is a thyroid hormone to regulate the calcium levels, but it is not used nowadays. So that liothyronine sodium 5 microgram is added in the cases which are resistant to the levothyroxine. Here there is the levothyroxine plus liothyronine combination, that is if the levothyroxine is not working well, one can combine it live. And that was in the past natural desiccated thyroid gland from the pigs. Now, treatment of myxedema coma that need intensive care treatment of the breathing, temperature, blood pressure and sodium level, all the vitals have to be maintained. It is an acute medical emergency. Mechanical ventilation with hypertonic fluid replacement, vasopressor agent to maintain the blood pressure, careful rewarming and corticosteroid for adrenal insufficiency for rapid treatment of the hypothyroidism, levothyroxine or liothyronine. It is given IV, or if the patient is unconscious, one can give intravenously and put the nasogastric tube. In case of the pregnancy, monitor the serum TSH level closely. Use the levothyroxine to keep the TSH level within the normal range for that trimester. In the first trimester, keep the TSH below 2.5 micro international unit per liter, and in second and third trimester below the 3 micro international unit per liter. Treatment is guided by the total thyroxine. The levothyroxine dose is increased after the pregnancy is confirmed. Women with anti-TPO antibodies need thyroxine even if TSH level is normal. It reduces the risk of preterm birth and miscarriage. Monitor the thyroid function every 4 weeks in the first 20 weeks of pregnancy. And here one can see the result of this treatment, hormone replacement therapy, before and after treatment, here before and after treatment, and in men, the before and after treatment, and the woman of this size becomes this size. Now, the prevention of the disease is adding iodine to commonly used foods, that is called salt iodization, to eliminate endemic childhood hypothyroidism, that is thyroid hormone replacement with levothyroxine in case of the cases, childhood cases. Promote the consumption of the iodine-rich foods like dairy and the fish. Some countries with the iodine deficiency advised universal salt iodization, which is called USI. 70% of the world populations are receiving iodized salt. Iodized salt is added to the bread in some countries. World Health Organization recommends daily 250 microgram for pregnant and the breastfeeding woman, and 150 microgram for the normal adults. So that is the end of the lecture, and I have given as much as possible, and I hope you will like it. If you like it, just subscribe it and share it with others. For any question, you can call me anytime, and then thank you very much to be with me and just having my lecture